Agradezco.
I thank Mr. Alakbarov for his briefing. I now give the floor to Ms. Joyce Msuya.
Mr. President, members of the Council, as I brief today, I'm reminded of previous messages we have delivered to this Council over the past months, cautioning that famine, then a worst-case scenario, was becoming increasingly likely. On 22nd of August, the Integrated Food Security Phase Classification Famine Review Committee confirmed that famine is now occurring in Gaza Governorate and is projected to expand further to Deir al-Bala and Khan Yunis by the end of September. Allow me to share some numbers. Over 500,000 people currently face starvation, destitution, and death. By the end of September, that number could exceed 640,000. Approximately 1 million people are in emergency IPC phase 4, and over 390,000 are in crisis IPC phase 3. Virtually no one in Gaza is untouched by hunger. At least 132,000 children under the age of 5 are expected to suffer from acute malnutrition between now and mid-2026. The number of those at risk of death among them has now tripled to over 43,000. For pregnant and breastfeeding women, that number is predicted to surge from 17,000 to 55,000. My colleague from Save the Children will speak in greater depth on this. The suffering of children remains one of the most heartbreaking dimensions of this crisis. Mr. President, behind these stark numbers are human lives, daughters, sons, mothers, and fathers, futures cut short and communities scarred. The Famine Review Committee has been called 5 times to assess food security and nutrition in Gaza. We sounded the alarm after each of these assessments. We also reported to the Council twice under Resolution 2417 on conflict and hunger, first in February 2024 and again in June this year. Let us be clear, this famine is not a product of drought or some form of natural disaster. It is a created catastrophe, the result of a conflict that has caused massive civilian death, injury, destruction, and forced displacement. Last month, over 100 Palestinians on average were killed every day, according to the estimates by Gaza's Ministry of Health, nearly twice the average daily toll recorded in May. In the same period, some 800,000 people were newly displaced, pushed into overcrowded areas that lack shelter and other essentials. This famine is also the result of 22 months of restricted and compromised delivery of essential humanitarian and commercial supplies, degraded health and nutrition systems, lack of adequate shelter, and broken water sanitation and hygiene networks, which have accelerated the spread of disease and turned menstrual hygiene into a nightmare for women and girls. The famine in Gaza is also the result of a destroyed food production system where 98% of the cropland is damaged or otherwise inaccessible, and where livestock is decimated, as ASG Alakbarov has just shared. Mr. President, we have seen an uptick in aid entering Gaza over the past weeks, including in the number of trucks and fuel tankers. During this time, the UN and our partners have brought in at least 12,000 metric tons of wheat flour, supported 80 kitchens serving 400,000 meals daily, brought in therapeutic food for 30,000 malnourished children for 1 month, delivered truckloads of vital medical supplies, including blood units, and ensured clean water reached over 1,000 locations, alongside hygiene kit distribution and network repairs. Limited commercial traffic has also resumed in the past weeks. This has helped to bring down prices of key commodities, although they remain elevated and largely out of reach for much of the population. And after a long pause, supplies of animal fodder have resumed over the past several days. These are important developments, but they will neither reverse famine nor stop it in its tracks. To meet the needs of 2.1 million starving and hungry people, we need much, much more.